So my name is Faye. I live in the West Midlands in the UK. I'm a clinical nurse specialist and I was diagnosed in May 2023. On the 13th of April 2023, woke up in the middle of the night with pain in my hip, and I went to A&E. They told me that they would refer me for an ultrasound scan. I had that about a month later. When I had that scan, it came back as normal. There was no problems there, but the pain was still there. They told me that I would go and see a trauma and orthopaedic surgeon. So I went privately and saw one within a week. Within a week, I'd had a MRI scan, and that came back about 5 days after I'd had the scan. The consultant called me, and I was at home, I was upstairs. And he asked me who was with me at that point. And I was with my husband and my daughter. So he said, go and fetch them. And then I knew something was wrong. To be told, that you've got cancer over the phone was just awful. But I don't know which way he was going to get me to the hospital any sooner. So anyway, he told me that I needed to go to his local hospital, and I needed to have a CT scan. So I had the scan the next day, and I went the following day for a CT scan, and then they told me that it was definitely cancer. It's either myeloma, lymphoma, or it's metastatic disease. And they told me that they could see a thickening in my esophagus, so I needed to see, I needed an endoscopy. So from April 2023, when I was in pain, to June when I started my treatment. So I got my diagnosis in the May 2023. So it was pretty quick, really. Telling family, I think, was the hardest thing. I've got 4 children, and to get them all together. My son lives in Derby, and I've got 3 girls that live local. So to have them all around was one of the hardest things I think you ever have to say to your child, is that you've got cancer. I did try and stay positive throughout, and keep, especially for people around you, you try and make them think that everything will be okay. It's hard to feel hopeful at some points because without evidence, as in scans, so you have your treatment and it's a long time between you first starting your treatment and you having your midway scan. Well, it felt like a long time to me. So having this lymphoma has affected me in many ways. I'm a nurse, so I was able to go to and from work, so there was some kind of interactions with other people. But once you have a cancer diagnosis and you're told that you need to isolate, that is really difficult. Especially for me, it was at night time when I was in bed, and I'd wake up in the middle of the night and there's nobody there. That was really hard. Some of those were like the darkest moments I think I've ever had in my life. But I've got faith, which has helped me a long way. I've got great family, I've got great friends that have helped me along the way. It's either phone calls or they would come up and see me as long as I didn't have coughs and colds. But I was stuck in this house for literally 6 months whilst I was going through treatment. Mentally, I think I'm quite a strong person anyway, and the things that I would be telling my patients to do is what I was trying, giving myself my own, telling myself these are the things that I need to do. I am a very sociable person. I like to be out and about. I was able, fortunately, to, whilst I was on treatment, still be able to work to some degree. My boss was fantastic in so much that I could work from home, answering emails or phone calls where patients would call in. So that kind of kept me busy, because in the daytime, everybody else is going about their lives, they're going to work or doing the things that they do, but being stuck at home all the time, this was a little outlet for me to be able to continue to work in some way. But the tiredness was a huge factor. I'd have to go and have naps quite frequently. and just stop a lot of the time. It's really difficult, I think, talking to a professional about how you feel, about what you need. And as a nurse, there's a level of understanding that I understand, but then going into lymphoma, that is a totally different ball game for me. It's not something I'd ever come across before. So the terminology, I think, can be quite difficult. And I think knowing where to go and do your research and find out what the doctors and nurses are actually saying to you is really key. But I think making sure that they talk to you at a level that you understand is really important. My clinical nurse specialist was actually really good. She's very supportive. If I had any questions, I was able to call her. At one point, I rang her and I said to her, I think I'm going crazy. And she kind of broke everything down for me, things that I was asking her. You know, she said, they're not silly questions. They are relevant to how I was feeling. When you're alone at night and things seem to be, you kind of catastrophise everything that's going on. So if you had, like, I had a symptom, I can't remember what it was offhand, but it was just like, just call Kate up and she would guide me through what I needed to do to be able to get over whatever was happening at that time. My consultant, I think, was very focused on the type of treatment that I would be having. Like, I asked her at one point, can you show me the scan? And she said to me, I don't show people scans, I just read the report. And as a nurse, I need to know, I need to see the full picture. So then I went in to see my clinical nurse specialist and she said, oh yes, you know, she went through all the scans with me. So I think, you know, sometimes you need to stop and listen to what your patient is asking you. It's not that, you know, I'm a radiographer and you know, and I can determine exactly what's on a scan, but you can show me a picture of what it was like and where I am at now and explain to me what's happening in between. That would put my mind at rest. So some people communicate obviously better than others. And I think just stopping and listening to what your patient is saying is really valuable. I tend not to look at years and years ahead. I can't see it right now. It's not to say that I'm not going to get there, but I find that really difficult. I think I'm living month to month really, and I'm just enjoying where I'm at. You know, it's as a family we've reflected on what has happened to me and what could happen to anybody really, in so much as I value the time that I have with my family and my friends. I'm not as active as I would like to be, but you know, we've been on that many outings and holidays and just really appreciating the good things in life. And my advice to anybody is just take it one day at a time. Why do you need to know what's going to happen in 10 years' time? Because actually nobody does. So for me, the future, I think I'm going to be retiring in the next 5 years maybe. I've got 2 grandchildren, 2 grandsons, and I've got another one on the way. So for me, it's just enjoying life, just stopping in the moment. I went on a getaway a couple of weeks ago with my husband and was in a hot tub. It was freezing, but it was so lovely. I just looked up and there were just trees and the moon was just shining through these trees. I thought, what a beautiful moment, you know, and I'm really grateful for everything that, you know, I've been through and that the doctors and the nurses have done for me. You know, I am so grateful for everything. I think lymphoma is evolving all the time, you know, and the treatments are changing so frequently. And that's such a positive thing to remember, you know, when you're going through your journey. Things have changed hugely in the last 10 years. And what is it going to be like in the next 5 to 10 years? You know, things have changed and moved on. So, you know, I think people just need to try and stay positive through their journey, look forward to something, you know, that's going to give you some joy in your life, you know, and just move forward that way, I think. I think for somebody that's newly diagnosed, don't catastrophise everything. Write things down. Speak to your clinical nurse specialist or your consultant, if you have a good relationship with them. Talk to your family and your friends about how you're feeling, because often you feel like you're the only one that's going through it. Well, actually, it's the people around you as well that are lifting you up and carrying you through this time. So my advice is stay away from Google. Use proper platforms. Lymphoma Action was actually really good for me. There's a Facebook group that you can join, and there's people that have walked a mile in your shoes, and they are there. They will support you. You'll hear good stories and bad stories, and it's your choice to make what route you go down. You are in control in a sense, because you're the one at the end of the day can say what you do and you don't want as far as treatment or involvement in what you're going through. You need to take control and just get the support that you need. Listen to your body. You've got all these professionals telling you that you're okay, and scans and imaging and all of that is great, but in your body really, if something's not right, then you need to pursue it, and don't stop till you get the answers. I'm strong. Yeah, I'm really strong, mentally, physically, emotionally. Yeah, I've had my breakdowns and good days and bad days, but to come out the other side and knowing what I've gone through and what I've learned about myself is that the information that I was given to other people, sometimes you need to take a spoonful of it yourself.